warm welcome to our esteemed participants joining us from across the globe for today's webinar, Bioinformatics Career, Trends, Opportunities, and Essential Skills. We at Dr. Omics Labs are committed to providing platforms that bridge the gap between academia and industry. Today, we are privileged to have a pioneer in the field of bioinformatics with us. Without further ado, I am delighted to introduce our esteemed speaker, the CEO and founder of Dr. Omics Labs, Dr. Deepshika Satish. Her expertise and insights are valuable to the bioinformatics community. I'm confident you will gain immense knowledge from this session. So thank you for joining us. Without further proceeding to the further session, please note that attendance sheet will be circulated in the last 10 minutes of the session. And yes, 100% attendance throughout the session is mandatory for your certifications. So let me welcome Dr. Deepshika. Welcome, ma'am.
Thank you, Sakshi. Thanks a lot. Good evening, everyone. My name is Deepshika, and the topic of this discussion is bioinformatics careers, trends, opportunities, and essential skills. I'm so glad to have you all. This was a very planned type of webinar because each and every time some of you were asking that what are the career opportunities available for us, how we can get into such kind of new coming field of bioinformatics, including next generation sequencing, data analysis, machine learning, computer aided drug designing, so on and so forth. So it was a very due kind of webinar, and I'm so glad that Sakshi has organized it. Let's start this. So let I share few details about my organization. Name of my organization is Dr. Omics Labs Private Limited. This is a next generation genome data analytics and intervention based deep tech company creating new edge solutions and interventions in bioinformatics and health tech space for India. So basically, we have two verticals. Every time there's a confusion whether you are a training sort of organization or you are a bioinformatics lab, what you are, right? So I would like to make it very much clear that we have two verticals. The first one is dedicated for development of DNA-based test. For example, in the coming slides, I will make you aware that we are coming up with so many type of tests based on DNA. Apart from this, there was a huge gap in industry and academia. To bridge that gap, we are providing internships, courses, and industrial training based on bioinformatics only. Star mark, we don't provide internships or trainings in any other field except bioinformatics. So short and short, what we are doing, we are creating workforce in the field of bioinformatics, and we are applying those skills in our vertical one and developing different kind of tests, right? So these are two type of verticals in my organization. And this is me. I have done my PhD in translational bioinformatics from world-renowned International Center for Genetic Engineering and Biotechnology. I have more than 10 international peer-reviewed research papers with H-index 7 and citation count about 310. Recently, we participated in healthcare entrepreneurship and management program offered by IIT Delhi. There were more than 100 startups there, and gladly Dr. Omics was topper. Apart from this, recently we got incubated at Government Institute of Medical Sciences. Today I attended a very prestigious boot camp related diabetes as well. So mission of my company is that we want to provide personalized genetic information to empower individuals. And mission is to advance the precision healthcare accessible and affordable to everyone, to make this thing accessible and affordable to everyone. These are the certifications of Dr. Omics Labs. We are Government of India certified, that is Skill India certified. We are Startup India certified. We have ISO certification. Apart from this, we got a $5,000 grant from AWS for research purposes. We have signed 5-year-long MOU with Andhra Pradesh government. We are providing bioinformatics-based internship to Andhra students. Along with that, we are pretty much popular on LinkedIn. Hopefully, all of you know that. And those people don't know that, please follow us. And we are expanding our business throughout the globe. This is my wonderful team. Half of our team is doctorate or beyond doctorate. That's why the name of this organization is Dr. Omics. We have wonderful Dr. Chavi Makkad as our MD, as our geneticist. She is MD in anatomy. Dr. Om Prakash is having more than 15 years of experience. Dr. Risha is also a postdoc from Tata Cancer Research Institute. Dr. Sudarshana, she is PhD in computational biology, so on and so forth. I have a very wonderful team. And most of them do belong to very prestigious institutions like ICGB, IGIB, CSIR, BIT, Tata Institute, so on and so forth. So these are our DNA test suits. Trichogeny for hair, nutrigenomics for different kind of health problems associated with our nutrition, diabetes, cancer, and recently we are going to launch our pharmacogenomics test. Let's begin this webinar. The topic of this webinar is bioinformatics and recent trends. So enough about my organization and myself. From this slide onwards, I will talk about the recent advancements in the field of bioinformatics. Along with that, after that, I will explain that how you people can explore the different kind of opportunities available in this field and what type of opportunities are available, right? If anybody has any question, please write down in the chat box. Sakshi, please remind me if anybody is there in the chat box.
Yes, ma'am.
So in the recent time, in last 10 years or so, bioinformatics has become a buzzword. There is no doubt that bioinformatics is not future, this is present. In last year only, we have seen a lot of very advanced things coming up in the sphere of latest research, and bioinformatics was behind that thing. For example, human Y chromosome, solving the 50 years old blood group enigma, large language models in biology, alpha missense. There are so many things, right? So I would like to discuss a bit of them. Let's start. So talking about top emerging trends, I would like to introduce you with a very basic slide. This slide shows that what are the top emerging trends in bioinformatics. And you can say bioinformatics is amalgamation of all these kind of expertise. For example, artificial intelligence and machine learning, single cell omics, multi-omics, QSAR, structural bioinformatics, spatial transcriptomics, database development, quantum computing, blockchains, so on and so forth. So whenever you are talking about bioinformatics, you are talking about all of these simultaneously. Some of you will be having expertise in one area, some of you will be having expertise in another area, right? For example, talking about doctoromics, we have expertise in genomics kind of area. We are utilizing DNA data and we are trying to provide you with basic insights about your health. We don't use blockchain, you can say, and spatial transcriptomics as of now. But maybe within next 1 year or so, we will incorporate that feature as well. So bioinformatics is such a dynamic field. If you want to get into this field, you must brace yourself with the intention that anytime there will be a new thing and you need to incorporate that into your skill set. Every 2 years, technology change itself drastically. For example, few years back, microarray was the biggest thing. Nowadays, people don't utilize microarray that much. It is in the verge of getting obsolete, right? Nowadays, we are utilizing RNA-seq data, DNA-seq data, and after that, hopefully, we will switch to single cell omics. So, if you are trying to get into bioinformatics, please be assured that you need to learn new things till your last breath, right? So be aware of that. Eliminating the brain's inner working. It was never possible without bioinformatics. Mapping the connectome. There are so many types of ohm you must have heard about till now. And now we are talking about connectome. Connectomics is a rapidly growing field that aims to map the intricate wiring of the brain, including connections between different neurons. Recent advancement in diffusion MRI and traces are allowing researchers to create increasingly detailed connection of the human brain. Things are getting so different nowadays. We are talking about brain computer interfaces. You must have heard this somewhere, you must have seen this somewhere, that there will be a hole in the cranium, and by using that hole, computers are getting connected with the brain itself. This is a new era where people who can't speak will be able to speak using such kind of brain computer interfaces, shortly BCIs. Advancement in BCI hold promise for restoring communication and mobility in individuals with paralysis and other neurological conditions. This is nothing short of a miracle. Those people who haven't said a single word since their birth will be able to speak. This is genuinely wonderful. And bioinformatics is behind such kind of miracle, right? No need to say this again and again. So the next thing is bioinformatics is revolutionizing cancer research. I don't know how many of you ever heard about this terminology, but we are talking about liquid biopsy now. Biopsy is very prevalent nowadays. You need to cut the tumor or the suspected cancer cell, and then using the physical things, you just explore whether it is cancerous or not. But this biopsy technology itself is very problematic because the tumor itself is in very aggressive mode. It is multiplying to numerous numbers, right? And this is why it is known as cancer. And when we are cutting a piece out of that thing, it aggravates the problem. So, short and short, when we are agitating a cancerous cell, we are aggravating the problem. And using bioinformatics, what we can do? We can utilize blood as a sample. We are not becoming too and too much invasive. And we will just utilize blood and the revolving short DNAs or tumor DNAs, right? And we will be able to provide you the first-hand information that whether the tumor is cancerous or not, or if it is cancerous, then at what stage it is. It is very surprising that by using liquid biopsy, we can tell you that the tumor is at first stage or second stage. This is very miraculous that we are not pricking the tumor, we are not aggregating the problem, and we are providing very precise information regarding cancer. Such kind of thing is revolutionizing cancer research. Apart from this, AI and machine learning are creating next level of advancement. Today I am at one of very renowned doctor, one of very intelligent doctor in Government Institute of Medical Sciences. And he told me that he is developing a very beautiful device using AI and machine learning. What he is doing, he is trying to take picture of oral cavity, and then he will be able to provide first information that whether a person is having oral cancer or not at very, very initial stage. This is beautiful. This is wonderful. So using genomic data, I will tell you in the later slides how we are utilizing genomic data and how we are utilizing genomic data to predict that you are having such kind of biomarkers and mutation, and this, you are just a loaded gun, right? You just need that particular environment, and you are prone to such and such kind of diseases with very precision, right? So bioinformatics is revolutionizing the medical field to a very great extent. We are just pushing drug discovery to the new boundaries, and there are a lot of advancements in technologies and methodologies. Along with that, every one of you must have heard about human Y chromosome, right? Fully sequenced at last. Basically, Y chromosome is much more than men thing, or you can say it is not about male and female. It has a lot more possibilities. The complete sequence paved the way for further investigation into role of Y chromosome that it play in male health just beyond fertility, right? It has link with cancers and immune function as well. So at last, Y chromosome was sequenced, and it has unexpected diversity among the masses to a very surprising degree. In the coming years, we will see that what and why and how this Y chromosome is changing the landscape of human health. Okay, AI-powered test revolutionizing diagnostics. Unprecedented accuracy. It is speeding up the treatment, and we can't leave behind personalized medicine out of the stock. Basically, the situation is this: AI is empowering every healthcare practitioner to the next level. Though there is resistance on the part of practitioners, there's no denying in that. But AI is revolutionizing this space as well. The accuracy is unprecedented. When I was doing my PhD, my group only was working on glaucoma, and these people have developed a very wonderful kind of device. By clicking the picture, and just you need to feed the picture of eyes, and that device is able to tell with very high accuracy whether that person, specifically they were working with kids, so whether that kid is having glaucoma or not. Glaucoma is a very dangerous disease, and it is detected at very later stage. That makes this treatment more complicated. So this was a single case. Every now and then we are able to witness a lot more AI powered tests, right? We are in that era where precision is becoming a thing. Talking about precision, we in Dr. Omics are coming out with precision medicine in next month only. The name of this precision medicine test is pharmacogenomics test. In scientific language, it is known as pharmacogenomics test, whereas in the layman language, we call it as precision medicine. So using FDA approved mutations and FDA approved drugs, we will be able to tell you with very high precision that whether this drug is suitable to your genome or not, and in what doses it should be administered, right? This is a new era. We can't deny this. Now human beings are no more any guinea pig. Whenever you are going to a doctor, whatever he is doing is nothing but hit and trial. He is just using his experience with different type of patients on you. He is not sure whether this drug is going to be suitable with your genotype or not. But because that drug was suitable to maximum people, he assumed that this drug will be suitable for you as well. What if it is not? I would like to share a very surprising fact here. You people must have heard about this chemotherapy. I am sure that you people will be surprised to know that 60 to 80% people whosoever just receive this chemotherapy, their first round is not compatible to their genotype. And this is the reason why in the second term, most of the medicines are changed by the doctor. Just try to understand that a patient with cancer is already suffering with a lot of things, right? If she or he was having breast cancer, so there was already a massive operation was there, right? After that, you are making that person to go through such kind of very harmful medications, and you are not even sure whether these medications will be helpful in their condition or not, right? So it will make this thing a little bit more worse. But what if we are able to tell you people that this medicine is very much suitable to your genotype and this is the dosage that should be administered? It will do miracle. Recently, I visited Sir Gangaram Hospital. That is a very prestigious hospital in New Delhi. And I visited a cardiac surgeon. I asked him that what are the bottlenecks you are facing? He said that there are 3 drugs, statins, and there were 2 more drugs there. Atorvastatin was one among them, and I just forget name of the other 2 drugs. These are the drugs that we are facing problem with, and some of the patients are getting wonderful results, whereas the other of patients are not getting good results. Apart from this, these people are showing very harsh kind of symptoms. So if somebody is able to tell me that this drug will be compatible with this patient, then it will be pretty much wonderful for me. And I gladly said that all of these 3 drugs are in our panel. He was very glad. So in recent months, we are going to start our clinical trial because the panel that we have developed so far is based on Caucasian population, and apart from this, we just want to prove that yes, FDA has approved these mutations and these drugs, but we would like to be more certain about Indian population as well. So after doing that, we will roll up such kind of personal medication test in India as well. So talking about alpha missense, what is alpha missense? Alpha missense is a computational tool that predicts the impact of single amino acid change in protein. Whosoever has ever worked with computer-aided drug designing they must know about AlphaFold. This is a very powerful protein structure prediction tool by AWS, I suppose. So Alpha Missense is another tool in that line only. But when we are dealing with this protein structure prediction, it is a very tedious process, very computational power intensive, and we need to be we need to follow very precise protocol while finding such kind of structure. If we are doing crystallography, then it is very time consuming. In ICGB, there is a crystallographer, and one of my friend is doing such kind of things, and she told me that this is genuinely tiring. But if we are talking about computational methods of doing so, it is not equally, but to some extent it is tiring too. So AlphaFold is pretty much very much automatized process of doing protein structure prediction, right? And this one is my favorite. My father was a secretary of Red Cross, so there was a blood what is the right name, blood camp or blood bank, sorry, there was a blood bank near to my house, and this was everyday business. There was a hue and cry that somebody needs blood, somebody needs this much in it and that much in it, there was accident and so on and so forth. So recently this took my attention that recently using a very advanced bioinformatics pipeline, some scientists were able to understand the basic mechanism behind the blood groups. And now we have become so powerful that we can convert any blood group into universal blood donor. This is wonderful. This is wonderful, really. Reason being, in blood banks, many a time, blood is available, but that blood group is not matching with the desired blood group. This is a very evident fact that if a patient is having B positive, just give me a second, I need to switch off my mobile. Sorry. Just a second. Please confirm if I am audible.
Yes, ma'am.
And visible.
Yeah.
Sorry for disturbance. Okay, so if, for example, I am B positive, so if in any case I need blood transfusion, then the blood unit should be of B positive blood group only, right?
Sorry for interruption, ma'am. There is a question regarding ongoing topic.
Yes,
Are you
please.
taking right now or at the end
Yes,
of the
I would like
session?
to take it right now.
Okay. Yeah, there is a question. I didn't understand blood group example. Can you please elaborate?
Okay. I didn't understand blood group example. Okay. Basically, the situation is this. I would like to state with the initial fact that if somebody is A positive or B positive, and at any point of time, if that person need blood transfusion, then the blood group of the transfused blood and the blood group of that person, that means the blood group of recipient and blood group of donor, that should be exactly same. There should be no mismatch, right? Okay, I will come to that, Jessica. Okay, so But story doesn't end here. We don't have 4 blood groups. There are n number of blood groups. Though their percentage is very less, but yes, these blood groups are existing in the population. There was problem with these 4 blood groups, that is AB and O. But problem is not confined to these 4 blood groups. There are more than 50 type of blood groups available in human populations, right? So if there was need of that rare blood group, there was another level of problem. So scientists nowadays are able to find out such kind of enzymes, such kind of mechanisms by which they can convert any blood group into universal donor, right? And it was not possible without bioinformatics. Large language models, you must know about ChatGPT, but ChatGPT is not specifically, okay, Sarah, but ChatGPT was not meant to solve biological problems specifically. So there are multiple LLMs now available for medical sciences as well, right? Along with that, I have elaborated a lot on liquid biopsy in previous slides. I would like to state few of the facts that 5 million estimated new cancer cases diagnosed in US in 2024. Sorry. Yes, in 2024, there were 5 million estimated new cancer cases. Any detection, early detection is the key. 80% 5-year survival rate for cancers detected at early stage. This is a very genuine fact. If you are able to detect cancer at the earliest possible stage, then the survival rate is maximum. And liquid biopsy, along with the test of cancer predisposition, can become a game changer, right? I would like to mention a little about cancer predisposition test. There are some mutations in human genome that are very huge indicator of that cancer is going to happen in next few years, right? So if anybody is having family history of cancer or exposure to carcinogen is to next level, then I would definitely recommend that such kind of person should go through such kind of DNA test, which can make them aware about their genetic makeup, which can make them aware about the fact that how many percentage of chances is there that he or she will develop such kind of diseases. Cancer is not a very rare disease nowadays. I assume that there will be nobody in this webinar who hasn't AI will help bioinformatics webinar. So AI is part of bioinformatics. Pawan, we will take such kind of question at the end of this webinar. So I was saying that there is no person presumably in this webinar who hasn't seen anybody with cancer practically. Siddhi, I have explained the meaning of biopsy, but I would like to again tell you that biopsy is a phenomena or a test in that physically a piece of tumor is extracted from the body and then it is just seen to a very greater extent whether the tumor is carcinogenic or not, malignant or not. So carcinogenic was not the right word. Whether the tumor is malignant or not, it is ascertained by biopsy only. In biopsy, we extract the exact piece of tumor. In liquid biopsy, it is advanced method, and by using circulating tumor DNA or circulating tumor cells, we are able to tell that whether a person is having cancer or not. and at which stage. So liquid biopsy is at present trying to replace the traditional biopsy, right? So I would like to come back to the major point that cancer is becoming very prevalent nowadays. It is not a rare disease. My own mother had cancer. She was suffering from breast cancer, right? So, yes, and that was the time when I thought that I will mix something like that, or I will try to help people in diagnosing with cancer at very earliest stage, right? And yes, we are capable in providing you people with information whether you are having inclination toward cancer or not. We are providing you with predisposition of cancer. This is the biggest thing, right? Firstly, cancer predisposition test, and if we are able to detect that you have inclination toward cancer, then we can switch to liquid biopsy and we can be more vigilant, right? Now, switching to the main topic, that is molecular diagnostics. The biggest trend in this bioinformatics is molecular diagnostics. There are multiple companies available in this zone, and we are trying to provide our clients and everybody with very important information regarding yourself, your DNA, your health to the next level, right? It is also known as preventive diagnostics. Yes, Samritha, Samritha. Yes, we are able to provide the location as well. So preventive diagnostics is a term that refers to the use of the test, screening, and services to detect and prevent health problems before they cause symptoms or complications. So the major problem here is that whenever I try to communicate with a real doctor, or you can say a practitioner, then there's a problem of epigenetics. People are asking me if somebody is having a mutation, then there's no problem, because there are times when people are having mutations, but these mutations are not manifested in any disease. So why we are scaring a person with that kind of knowledge, which is not going to be manifested in any sort of disease? Then the only solution is this: we are not providing you half-baked truth. For example, if you are having a single mutation, there is chance that it will not be manifested. But if you have multiple mutations, and based on the network biology, if I'm able to tell you that these mutations are in very prominent sort of genes, and due to these mutations, there is very high chance that your genetic makeup is going to manifest this disease, then the problem of epigenetics is solved to certain level, right? There are undoubtedly two parts. The one part is genomics, and the second part is epigenetics, or you can say environment, right? If you have diabetes related genetic predisposition, and if you are having such kind of lifestyle that is sedentary, you are eating a lot of junk food, you are not moving, you are not doing exercise, then it is pretty much certain that you are going to have this disease in very early stage. But if you have predisposition of this disease, for example diabetes, and you have very active lifestyle, you are having healthy food, and you are pretty much conscious, then it is pretty much certain that there are still chances that you will develop this lifestyle disease, but in very later stage of your life. You can understand this in that manner that if somebody got developed diabetes, it is very dangerous kind of disease. It is not a small thing. Today I have attended a whole boot camp for that, and some people are living with this disease for next 70 years of their life, and pricking yourself and having insulin, and there are so many diseases associated with diabetes. This is such a horrible disease, and we don't take this diabetes very seriously. This is another serious matter. We will talk about that later. But if somebody is about to have diabetes and we can tell him, just stop eating such kind of food, move your body, and you are still going to have next 10 years without diabetes, it is a wonderful thing for him. We are going to provide you with knowledge that is powerful, that will make you more intelligent about your own body, right? So people are, this is about androgenetic alopecia. We are able to tell you about such kind of diseases as well in very early stages. Okay, let's get to the second part of this webinar. This was about the latest trend in bioinformatics, and now why every biologist must learn bioinformatics in the age of big data and AI. Talking about the question, is AI going to replace bioinformatics? No, we are going to utilize AI for development of different kind of tools and techniques. AI is part of bioinformatics. So biologists need to manage data, research enhancement, artificial intelligence integration, and biologists also want to automate the data analysis, personalized medicine, drug discovery, so on and so forth. These are the job opportunities available after having skills of bioinformatics. Why I'm saying after having skills of bioinformatics, why I'm not saying that after having degree in bioinformatics. Bioinformatics is a wonderful field and you don't need degree to get a job. If you are MSc in biotechnology, still you can have such kind of job opportunities, right? Wonderful part is this. For example, if somebody want to go in biotechnology industry, so somebody will ask you that please provide me the educational biodata. What are the scope of bioinformatics in the next 5 years? There are numerous scopes. Yes, MSc zoology, MSc botany, MSc microbiology, MSc biotechnology. Anybody can go for bioinformatics. You just need skills. You don't need degree. Regarding bioinformatics, people will not ask you for degree. What are the skills that we need? Yes, after pharma, yes, you after pharma also. Basically, short and short, you need knowledge about biology. You need to have skill set of bioinformatics, and you are good to go. This is that simple. What are the job opportunities? You can be a scientific curator, gene analyst, protein analyst, phylogenist, database programmer, bioinformatics software developer, computational biologist, structural analyst. So for all these kind of stuff, what you need basic but proficient knowledge regarding biology. We will answer all of these questions at the end of the slides. So basically, you need knowledge regarding biology and skills regarding bioinformatics. There are a different skill set need to analyze biological data, right? And computational biologists are the people who can do that. We just want to create a workforce that can analyze that data flood that we are expecting in next 5 years. Somebody was asking what is the future of bioinformatics in next 5 years. So this is the question. In next 5 years, you can expect data flood, biological data flood, right? Eastern countries, including Europe and USA, mass scale sequencing is going on. 1/3 of the nation is going to be sequenced in next 1 year or 2 years. This is the agenda of many countries. Who are going to analyze that data? Bioinformaticians are going to analyze that data, right? Apart from this, if you don't want job in industry, then you can also see job in research area. You can become research scientist, a research assistant, bioinformatics analyst, JRF. Anybody who is here for certificate only, please mark that in chat box. We will provide you with the certificate. If you are curious about bioinformatics, what are the opportunities, please stay here. But if you are constantly writing in the chat box, we need certificate, where's attendance sheet, it is disturbing those people who are here for genuine knowledge. Okay. Apart from this, you can become network administrator as well. So how we can start learning, right? In bioinformatics, there are two major fields nowadays. The first one is next generation sequencing data analysis, and the second one is computer aided drug design. Regarding NGS, you need to start with the basics. First of all, you must have good knowledge regarding the available databases. There are so many databases available nowadays. Out of those databases, how we can get beneficial data, how we can get, what are the minimum set of, yes, this is the answer of your question, Somnath. Please listen carefully. These are the skill set that is necessary to get job in the space of genomics. There are multiple space in bioinformatics. Out of that, if you want a job in genomics, this is the skill set that is required. The first one is you must know what are the good databases and how to extract data out of those databases. Then Linux is pretty much necessary. Without Linux and cloud computing, you can't do anything. Please star mark this. You can't do bioinformatics with your Windows system. You need a Linux based interface, right? Whether you are using Ubuntu or whether you are using Windows. If you are using Windows, you can use WLS. So Python is very nice. Why Linux? Because maximum of the tool is regarding bioinformatics is built for that language only. You are able to utilize maximum power of your computer. You are able to mold the tool. You are able to get your desired result using command line, right? When there is a graphic user interface, there is restriction, a lot of restriction. Right, you're right. So after learning Python, the next big thing is R. For better visualization, for statistics, R is very, very, very important, right? You can't skip that part. So you need to learn 3 languages. First one is Linux. Next generation sequencing is the full form of NGS. Linux, Python, and R. These are the three languages that you want to understand. Okay? After that, the second one for genomic space is you must have idea regarding few of the pipelines to analyze next generation sequencing data. There are multiple types of NGS data available nowadays. It is not limited to RNA-seq and DNA-seq. There are multiple type of things available, but we are not expecting that everybody will have knowledge regarding every kind of data analysis. What we are expecting? We are expecting that you at least should have knowledge regarding RNA-seq and DNA-seq data analysis. If you have further knowledge regarding targeted metagenomics, microarray, it is additional thing, right? After that, you must have practical knowledge that You must have developed a project around such kind of thing. It shouldn't be theoretical knowledge, it should be practical knowledge. It should be in that manner that you have extracted data from the available databases and you have converted that into real world project, right? If you have bookish knowledge, then it is not useful at all. Next thing is, if you are interested in computer aided drug designing, then apart from Linux, Python and R, you must have basic knowledge regarding GROMACS and multiple tools available in that domain, along with machine learning in drug design, right? You shouldn't confine yourself with that part where you are using GROMACS. You need to incorporate machine learning as well. Okay. Then if anybody is interested, Government of India has rolled out Bioinformatics Analyst course. The syllabus is approved by more than 20 industries. It has practical approach. It is providing hands-on learning that is live but online. It has multiple benefits, right? So third-party examination will be there after completion of course. Government of India recognized certificate will be there, and there will be a project development at the end of project. Along with that, there is 100% placement assistance that at least 2 interviews will be conducted. So at the end, this is the last slide. What are the ultimate benefit of bioinformatics and who should join? Basically, students who are seeking internships and high paying job should go for bioinformatics. I would like to say that very proudly that bioinformatics is the only life science stream that has capability to provide you with remote work capability, that too with a very meaningful career, right? You will be able to access high paying job. It is a gateway to research oriented career. Bioinformatics will provide you with alignment with industry trend. It will provide you with competitive advantage. For example, somebody was asking that I am a MSc in zoology, right? BioPearl is not that necessary. BioPython is part of Python. So that was end. If anybody has any question, let's start. There are so many questions. I'm so glad. Let's start. Okay, can you please elaborate the concept of bioinformatics data analysis and what actually they do and what it is actually about? This is a very basic question. I would like to answer that. Bioinformatics data is a very broad term. I would like to pinpoint next generation sequencing data. We all have genome, we all have proteome, right? We all have different kind of biological data, and using bioinformatics pipelines, we are analyzing that data. We are deciphering which type of modification has been done so far and what are the implications associated with it. Okay. Will AI help or replace? Definitely, it is part of bioinformatics. It is not going to replace anything. Biopsy test I have already cleared. Can we regulate the cells to never become carcinogenic through? This is future, I suppose. This is not very far, but this is supposedly future, because there is gene therapy already available, not in India, but in Eastern country, gene therapy is already available. So if there is genetic predisposition to cancer, and probably in future, probably in coming year, if government is allowing that, then theoretically it is possible, but there are some law-based constraint. In future, can bioinformatics will help to predict which disease evolve or disease X? Yes, yes, it is pretty much possible. From liquid biopsy can we also detect? Yes, we can detect. With help of bioinformatics, you told we can guess the disease we can get. So can cancer be detected also? Yes. Even Dr. Omics is also providing such kind of test. We are providing predisposition to different kind of cancers. There is, I just forget the name, there was a series on Netflix, and on that there was a journalist who find out that she is having mutations regarding breast cancer. Her mother was having breast cancer and she was so scared throughout her rest of the life that probably she'll also get that because she lost her mother due to breast cancer. And later she just checked herself with the genetic mutation, and yes, she was also mutated and there was consequences for that, right? And ultimately she was able to get rid of the faulty part. So yes, we can detect the predisposition regarding different kind of cancers. Recently, AI powered technology is developed which detect breast cancer 5 years earlier than actual occurrence of cancer. Yes, such kind of things are very much prevalent nowadays. What does tricogene mean? This is the brand name of our hair genomics test. We are providing a wonderful test related hair genomics, and in that we are providing genetic predisposition to 10 different kind of hair problems, including hair loss, baldness, male baldness, female baldness, and complete baldness, psoriasis, so on and so forth, hair graying, hair fall, multiple kind of things we are providing in this tricogeny test. I am final year bioinformatics student and need guidance for job in the bioinformatics field now, in New Delhi. Don't confine yourself with geographic area, right? Whenever you are talking about bioinformatics, whole globe is there. What I'm telling you, you just need two things. First thing, you must be very proficient in biology. Specifically, molecular biology concept should be crystal clear, right? After that, the second thing is this: you must have specific skill set to analyze biological data. That's all. Now, after having these two things and after having practical experience, you can apply for bioinformatics job all around the world. Don't confine yourself to New Delhi. We will discuss. Okay, what is the scope of bioinformatics? I have already told you that in India itself, very huge companies are claiming that within next 5 years we are going to sequence each and every Indian. So you can clearly understand that there will be data flood, biological data flood, and who is going to analyze that data? You bioinformaticians are going to analyze that data. MSc zoology, genetics, microbiology, pharmacy, everybody who has knowledge of biology is eligible for bioinformatics. This is that simple, right? What skills we need, I have explained that very explicitly. Yes, pharma can also go for that. Okay, I have done MS in bioinformatics, but I have gap of almost 6 years now. How can I start over? Go for LSSBC bioinformatics analyst course. They will teach you, and after that, they will provide you with the opportunity of interviews as well. This is that simple. This is a new age, right? We don't talk about gaps. We don't talk about degrees. We don't talk about such kind of redundant things. If you have knowledge, that's sufficient. If you are able to practically analyze the data, that's more than sufficient, right? So just brush up your knowledge, just add some more skill into your data, in your skill set. Go for Linux, Python, R, and multiple other things, and you are good to go. I'm in final year of biotechnology. Any skill needed for bioinformatics? A lot of things are needed. Where can we get knowledge of bioinformatics? If you want to go to harder way, go to websites, go to YouTube, go to different kind of channels available. There is knowledge, but unstructured, unreliable knowledge, right? If you want to opt for easier option, go for some sort of institutes who are providing structured and what I can say, practical knowledge. For example, we ourselves are providing good kind of courses where we are providing live courses, and that too. Sometimes people are confused that you are providing online courses, how these are hands-on. I would like to clarify that we are providing live, hands-on, practical training, that too online, right? Because we are talking about bioinformatics. When we are saying that you can work from home, then how you are able to do that job remotely, right? In the similar way, you are able to understand the concept remotely. You are able to do the job remotely. We are talking about bioinformatics here, right? I completed the MSc Bioinformatics and PG diploma in clinical research. What are the job opportunities? I have already told you that there are too much opportunities available nowadays. You just need skills. If you don't have skill, if you have degree, there's no usage. If you don't have degree but you have skill, you are still valued, right? What are the most effective bioinformatics pipeline for analyzing high throughput sequencing data and how they can be optimized for clinical diagnostics purpose? There are multiple pipelines available for multiple kind of data. You haven't specified here that what type of high throughput sequencing data it is, whether it is DNA data, whether it is RNA data, whether it is small RNA data. For every kind of data, there are so many pipelines available. But if you want to pinpoint one, the SAREC pipeline is the most advanced one nowadays. I have done MS in bioinformatics. I have GAP. Okay, you can go for the course. Prosthetic branch. Sorry, I don't have much clue regarding this. Science, bioscience, one need to have a know-how. I suppose so. I have so many friends in basic sciences, and in one way or another, if they want to get excel in research, anyways, they need to know some basics, at least basics of bioinformatics. They need to extract publicly available data. They need to show their results in wonderful charts, right? So anyway, bioinformatics is essential nowadays for research purposes, at least. I'm in my final year pursuing Master of Science in Medical Laboratory Sciences, Medical Microbiology, but interested in bioinformatics. Where should I start? You should start with the basics. You need to start with the basics only. I did M-Pharma and now pursuing MS in data science, specializing in AI and ML. What is the scope for me in future? Which path is best, AI or BI? It totally depends upon your interest. Everything is having scope. If you have very high level of skills, then everything is having scope. If you don't have skills or you have mediocre kind of skills, then there's not much scope for you. I just watch bioinformatics tutorial on YouTube here and there. It will confuse you a little, right? Structured database, structured knowledge is very important, because nowadays internet has become a very different kind of things. You will get lost in that sea of knowledge. So what is essential and in which step you need to get that knowledge, this is altogether different game. What is a minimum set of applications for bioinformatics that need to be learned to achieve certain opportunities you told about, ma'am? So I have told you that in the last slides that these are the applications that are pretty much necessary to get a job in genomics. Clinical research, everywhere it is having what I should learn. You need to learn Python and R both. You can't leave behind that I am more inclined toward Python, I don't want R. No, both are not only important, these are interesting languages as well. Bioinformatics, I have told you that as a final year biotechnology students, I suppose that I have answered maximum questions, right? If anybody is having any problem, unmute yourself and ask me questions. Sakshi, please allow everybody to unmute themselves.
Okay, ma'am.
Yes, somewhere Sarah was asking if there is a way that you people can contact us. Just type Dr. Omics Labs on Google. We are pretty much famous. Just kidding, just kidding. Yes, you'll be able to find us on Google and on LinkedIn as well. There is very functional phone number there. You can text us, you can mail us, right? And in the attendance sheet itself, you'll be able to provide us with few questions that you want to ask. We will reply to each one of these questions. Final year biotechnology and microbiology student. Yes, bioinformatics is future, right? If you want to get high paying job all around the world, then bioinformatics is a good choice, no doubt. How can we prevent abnormal protein formation in Alzheimer disease using AI? This is a very open-ended question, right? How much we have to pay if we start from basic course? This is very, very basic course is the cheapest course available with Dr. Omics. This is just because I want every biologist to understand at least basics of bioinformatics. In one way or another, every biologist will need bioinformatics, right? So this is the cheapest course available in 4,000 or something. There's a 1 month course in that. Average salary of bioinformatician in India. It depends that what type of job you are looking at. If you are talking about scientist, then you can expect a package of 12 to 14 lakh starting salary. If you are talking about bioinformatics analyst, then approximately 5 to 6 lakhs per annum. This I'm talking about initial salary in India only. When you are talking about foreign, especially Europe and the US, the situation is very, very different there. I'm a bioinformatics student. Can I apply for clinical data management? And these fields related. These fields are pretty much related, and you can go anywhere. If a person know that they carry a genetic mutation associated with higher risk of cancer, what step they can take to manage or mitigate this risk? It depends on mutation. Yes, this is pretty much very nice, very accurate. That it depends on mutation. If you are talking about breast cancer and you are having very high inclination toward developing this breast cancer, then surely you need to remove that part, because breast cancer mutated genes will affect breast only. So just removal of breast will help you a lot. And if you are having a genetic predisposition to different kind of cancers, so it totally depends on what kind of mutation you are having, and how many mutations are you are having, what is the network biology behind that. So there this is not a simple a plus sorry 2 plus 2 is equal to 4 kind of question. How can we prevent abnormal protein formation using AI? Specifically I don't know, but using gene therapy, yes, we can help that. What we can apply, where we can apply for internship for freshers? Anywhere. In Dr. Omics, we also provide internships. The pipeline I have used, this is for metagenomics. What internship to do to improve our knowledge, skill, and bioinformatics? You need to start with basics. Never jump to that thing that I don't need basics. I have heard this phrase many a times. Just provide me with the advanced level of course. I don't need basics. This is stupid. Don't go in that direction. If you want to learn something, basics are genuinely important, right? If you don't know how to write ABCD, you can't write paragraph. I know that you are mature enough. I know that you have done your masters. So yes, the thing that should have taken 6 months, you will be able to grab in 1 month, right? So we or any other organization must have compiled the syllabus in that manner that you will not feel bored, even if we are talking about basics, right? There are so many people all around the world who have joined our courses, and the same thing they have told us, that in every lecture we have learned new things. Every particular lectures, you can go and check our reviews and testimonials. You'll be able to get first-hand information that how people are feeling about our webinars and our courses itself. I guess that's it from my side, and I have just crossed the mark of 7, right? Thanks a lot for being part of this webinar. I would be more glad if anybody of you can unmute yourself and you can ask if anything is there. And if chat was the option, Sakshi, please have this chat and store this chat, and I will answer each one of these questions. I will
Yes, ma'am.
Any specific core reason of mutation in gene? There are multiple reasons, Abhinav. There are multiple reasons of mutations. We are living in the age of pollution. We are eating adulterated food. Everything is just second grade or third grade, right? So why we are exposed to more and more mutation, you can understand very easily. Okay then, thanks a lot. Thanks a lot everyone for being patient, for being part of this webinar. I'm genuinely glad to have you all. And I'm just a call away. Anytime anybody has any problem, please text us. We will reply to each one of you. We just have a single mission. We want to provide every biologist with the knowledge of bioinformatics, that too from the convenience of their home. That's all, right? Because this is not the future, this is present. Every biologist need bioinformatics, and we just want to become a medium for that. Thank you. Thanks a lot.